Hello, my name is Ashley Simpkins, and today I'm going to be demonstrating an IV start with a fluid bag attached. So before we do anything, we're going to follow our GPSB guidelines, our 11 rights of med administration, our 3 med checks, and our 2 patient identifiers. And we're also going to go ahead and assess for allergies, just in case. So we are going to check our order, make sure that this patient is ordered for an IV and for fluids. That checks out. They are ordered one, so we're going to go ahead and enter the room. We're going to introduce ourselves, and we're going to explain what we're there for and obtain our 2 patient identifiers. So we're going to go ahead and prep our bag. So starting that, we're going to go ahead and get our main line here. We're going to maintain aseptic technique. We are going to untangle and unkink our line, making sure that there's no kinks to be had. Oops, wrong one. Making sure that it doesn't touch the floor. And we're going to go ahead and slide this down to the end, and we're going to clamp it off. And we're going to put this in this pan. So as long as the end's not touching the ground, we are good to go. We have our cap. We're going to get our bag. We're going to uncap our bag, discard. We're going to uncap our spike, maintaining aseptic technique to not touch the spike or the opening of the bag. I'm going to switch my hands here. And then we are going to spike our bag, maintaining aseptic technique and not touching any sanitary spots. We're going to flip it over. We're going to prime our chamber, filling it halfway. And then we're going to go ahead and hang our fluids. So from this point, we are going to carefully uncap the end of our line, maintaining aseptic technique. We're going to open our line and prime it. Trying to make it to where you can see. Alright, we are good and primed. We're going to close this off. And then we are carefully going to replace our cap. And then we're going to go ahead and hang this with our fluid, making sure that that line stays sanitary. We're going to discard our bag, and then we're going to go ahead and prep and get ready to start our IV. So while we do that, we're going to go ahead and perform hand hygiene, making sure everything is nice and clean. We're going to prep our J-loop. So we're going to go ahead and take that out. I'm going to move this a little closer to me, making sure that it doesn't fall out of the package. And then I'm going to pull this out, maintaining aseptic technique. We are going to uncap our flush, discard. We're going to get the air out, attach the flush, and prime our J-loop, making sure there's no air in that. From here, we're going to take our sterile end, place it back in our package so that is safe and sterile. I'm going to scooch it away from my tourniquet. Alright, so our J-loop is prepped. We're going to go ahead and prep our Tegaderm so that it is at reach and easily accessible. We're going to discard. It has a little tag on here, but we are going to put our name, date, and time, discard, and we are going to lay this sticky side up so it doesn't touch anything. So from here, we're going to go ahead and palpate the site, find the vein that we want to access, and make sure that this site is okay and that there's nothing wrong with the skin or anything like that. So it seems okay. I found my site. We're gonna go ahead and apply our tourniquet. So we're gonna hold this down because it's a little wobbly. And we're gonna apply this as tight as we can because it's meat block. There we go. Making sure our tails are up and away from our insertion site. We're gonna check for radial pulse. We're gonna palpate that vein that we want, make sure it's okay. We're going to release that tourniquet because we don't want to cut circulation off. And then we are going to go ahead and do hand hygiene and don our gloves. So before I move further, we're gonna go and prep our tape so that way it's accessible and easy to get to, as long as I can find the end. There she is. So I'm gonna pull a little strip off. We're gonna tear this in half. And we're just gonna stick the very edge to the edge of our table. Just like that. Okay. So now we're gonna go ahead and open our IV start kit and get our cleanser out that is facility approved. We're gonna clean our site for 60 seconds, vigorously making sure that everything is clean. Going in every direction. Cool. Discard. Now we're gonna reapply our tourniquet. Again, being careful because it's a meat pad, and making sure that we do not touch our cleansed area. And we're gonna make sure that it is 3 to 4 inches above our insertion site. So before anything, we're gonna go ahead and check our pulse, make sure that it's okay. We're gonna check our patient and make sure they're tolerating everything pretty well, and they're good to go. At this point, we're gonna go ahead and get our catheter. Discard. We're going to use the OK method and uncap our catheter. Maybe. There we go. So we can discard that cap. We're going to inspect our catheter and our needle, ensuring that there's no abnormalities or anything that can happen during insertion. This one looks pretty good. We're going to make sure that it's bevel up. There we go. Now we're going to hold the vein taut. We're going to insert at a 10 to 15 degree angle. We're going to go ahead and push that in there. Once we get some flashback, we're going to go ahead and occlude your vein, secure the hub, and then we are going to advance that catheter just a smidge. We're going to go ahead and release your tourniquet, pull your IV out. We're going to administer our safety, and we're going to discard it into the sharps container. So at this point, we're quickly going to connect our J-loop using aseptic technique. We're going to go ahead and let go of our occluded vein, stabilizing the IV. We're going to pull back for flashback, and then we are going to flush it and assess the site, making sure that there is no infiltration or anything going wrong. Once you've done that, we're going to take one of our pieces of tape. We are going to stabilize our IV, and then you can let go. From here, we're going to go ahead and get our Tegaderm. We're going to cover the insertion site and just a little bit up over top into the blue part, but we never want to overlock that lock. Overlap the lock. Then we're going to peel this off, making sure that it's nice and secure. We're going to save that label. We're going to take our label, put our name, date, and time. So I get it off. Discard our trash. And then we're going to place it onto the Tegaderm, ensuring that the next nurse knows when it was applied. From here, we're going to go ahead and unattach our flush, get our second piece of tape, and we are going to secure our J-loop, like so. Doesn't like to stick to the knee pad. So there's that. From here, we're going to go ahead and doff these gloves, evaluate the site, assess the patient, perform hand hygiene, and make sure that they tolerated everything well, which they did. No complaints. Everything's good to go. There's no infiltration, no swelling, any irritation. So from here, we are okay to go ahead and connect our primary tubing to our insertion site. So I'm going to grab a pair of gloves. Well, I'm not going off camera, so we are not going to grab a pair of gloves, but we would do hand hygiene and don another pair of gloves. So from here, we're going to take our primed line and get it ready. So we're going to hold it here. We're going to get an alcohol swab. We're going to scrub the hub for 60 seconds at least, vigorously assuring that it is nice and clean and making sure to not disturb the IV site. Good to go. Discard your swab. We're going to carefully remove our cap from our line, ensuring to not contaminate. Switch hands, do not contaminate. And then we are going to attach our line to the hub. Just like that. Now before we unclamp this, we're going to check our IV pump. We're going to make sure the flow rate is per order and everything is going well over here. It's already set, connected, ready to go. So from here, we're going to go ahead and unclamp our line. We're going to assess the site, make sure everything's going okay, nothing is infiltrating, no swelling is occurring, everything's good. We're going to assess our patient, make sure that they're tolerating the fluids well, make sure it's not bothering them in any way, and we are then going to go and document what we have done per hospital policy, and I think that's it. Thank you.